today. And thanks, Dr. Prince, for waking up a bit early to be with us today. So for those of you who don't know me on the call, my name is Stella. I'm a program management officer, and I'm coordinating the urban health work stream under the planning, finance, and economy section in Nairobi, Kenya. The topic of urban health is really dear to our heart. It's also reflected in our strategic plan as an outcome of good planning and good sustainable development. So we have been working for a while on the topic, advancing both SDG 3 and 11, working on a multi-scalar approach from the global to city level, even neighborhood and the site level. We work closely as well with WHO, and we have developed lots of normative outputs together on how to integrate health and urban and territorial planning. But mainly what we have been focusing on is how to support governments creating cleaner, happier, and healthier environments. This is crucial because also the UN has recognized that healthier environments are human rights. So it puts more pressure, let's say, for planners, to consider how to do proper planning for healthier environments. Should go next. So in a nutshell, what we do is we, in the planning, finance, and economy, we try to look at health as an outcome of good planning. And we look at the approach on how to integrate it within our processes. And that could be through multi-sectorial collaborations, through integrated evidence and data sharing, innovative funding mechanisms, and local actions. And we avoid looking at the planning as like sector by sector, but really how to integrate all the different aspects together. One of the key also component is the knowledge and capacity building. And this is why we wanted to emphasize on launching this like brown bag series, and not just for people outside, but also for our internal knowledge. I think there are many colleagues here who are not familiar also with the subject, who have expressed interest in knowing more about how their work could also improve health and well-being. We have been focusing a lot on urban health, but not much on well-being and mental health. And I think this is where we reached out to Dr. Prince, who has more knowledge on that subject, to tell us more about the relation of urban environments and mental health. So without further ado, I want to introduce Dr. Prince, who's an assistant professor in the Department of Global and Environmental Health at the New York University. He's a geographer who uses big data and multi-method approaches in his research, but he also specializes in visualizing the distribution of risks and health burdens associated with environmental exposures. So we're very looking forward to hear from your experience on that subject and to gain more knowledge on the matter. So Dr. Prince, the floor is yours. You can now share your screen.
Thank you, Crystal. I will share my screen. Let's see. Can you see the screen, or you see the?
Yeah, you see the note, so you can.
The note. Okay, so let me swap. Yes.
Yes, now it's please.
Okay. So as Crystal rightly said, I'm an assistant professor with the Department of Global and Environmental Health. We became a department this summer, and it's part of the New York University School of Global Public Health. I'm a geographer by training, and my research focuses on understanding spatial relations in health and health outcome, especially with focus on environment and climate. So when I was given the offer to talk about my research, even though I know about UN Habitat, I was wondering what of my research to talk about. So I decided to focus on one of the EU projects, or two EU projects that we're working on that focuses on mental health. And I'll show the reason why I chose this topic other than some of my environmental health, like air pollution research. So in terms of presentation, I'll talk about the relationship between place and mental health, then focus on geography, the role of geography in understanding mental health, what are the innovations, prospects, and opportunities that it offers to us as researchers and as policymakers. Then I'll move on to explore how we've used some of these geographical methods and techniques in understanding the relationship between urban environment and mental health based on insights from two EU projects that I worked on. I'm still currently working on one of them. So in terms of outline, often we define places as locations that are imbued with meaning, because wherever we are, the space that we occupy, there are often some relational attachment that we have with such locations. It could be cultural, it could be economic, it could be political. So if we talk about economic, for example, the spaces that we occupy right now, be the UN Habitat campus in Nairobi, it's a policy environment where decision makings go into or formulating decisions for the urban space. It's also a place where people work and live in. So there are these meanings and bonds that people form with locations. Now, these values often affect our health in the sense that our relationship with the space or the environment that we live in often impact our health in one way or the other. For example, our workplace can be enjoyable when you have maybe good correlation or relationship with your colleagues or bonds with your colleagues. However, if you work in a toxic workspace, it can be very mentally distressing for you as a worker. And aside that, research have shown that there is values, health values or well-being values in environment in general, the physical environment. In terms of green and blue spaces, there's been a lot of research that have shown the link between growing up in green environment or blue environment and how it enhances mental well-being. For example, there was a study in Denmark that showed that children from age 0 to 10 years, those who lived in more greener spaces, were less likely to suffer from some mental health diseases such as schizophrenia. And there were other research, there's been other research to support that idea as well. Aside the physical environment, research also shows, when we define environment broadly to incorporate social environment, we also see that our social relations in terms of social capital also enhances our mental well-being. So isolated people who are lonely are often more likely to be depressed because of lack of human interaction. And there's been so many theories, psychological theories, as in why that is the case. But we can think of mental health as a moving target because so I just picked this diagram, which is Aarhus. I don't know whether many of you are conversant with Aarhus. It's the second largest city in Denmark. And this is my Google map planning. I was going for a conference, citizen science conference in the main campus. And I was traveling from the train station to the campus. And these were the three options that Google gave me if I'm riding my bicycle. And you can see that each of the routes take me through different kind of urban environments. You have one that is passing close to the harbor. You have one passing the inner city and one passing mostly green spaces. And all these things can affect your mental health in the sense that based on where you are going, who you interact with, the environment situation, that mobility, traffic situation, it can either cause stress or anxiety within your commuting, or it can enhance, for example, the visuals that you see while traveling to work can enhance your mental well-being. Sorry. So alternatively, if you come closer home to Nairobi and you want to go to the UN campus, you also see these alternatives. You can see that it passes through different environments, and based on where you pass and the kind of interaction you have with the environment, it's more likely to impact your health. So there's been many research on the pathways between urban environment and mental health. There's been research on noise pollution and stress, and how noise causes excessive noise causes certain hormonal changes in the human body, hence contributing to stress, high levels of stress and anxiety. There's been research that also shows that green spaces associated with what is termed as restorative well-being, where it induces or creates an environment for calmness, and by so doing, causes us to distress from some of the everyday challenges that we go through as human beings. And as I talked about, social isolation and loneliness has also been linked with mental health. Air quality and cognitive function, the same thing, research has shown that poor air quality due to pollutants can cause mental impairment or cognitive impairment, and potentially exacerbating mental health issues. And also the built environment, how environment is planned, built, as Crystal was talking about in the introduction earlier, all affect our mental well-being. For example, do we create spaces that are more navigable for especially disadvantaged populations, such as those with disability and others? Are we creating environments that is equitable in terms of the urban space? All these things can affect one's mobility and also their mental health in the process as well. So what is the role or benefit of geography when we are looking at the urban space and its relation to health? Now, there are three main tenets of geography or pillars of geography, and space is one of them. The second is time and holism. Now, when we talk about space, we are talking about the locations, areas that we occupy or inhabit as humans, the surroundings, our surroundings in general. We talk about time because over time, we make modifications to the environment that we live in, and these modifications impact the environment itself as well as our own health. And we talk about holism in the sense that the things that happens or appear around us are not in isolation, they occur together. So for example, a modification to a wetland in an urban space does not only affect those who are going to inhabit that space, but the general urban environment, and even to some extent, the global environment as well, because of some of the vital roles that the natural environment plays in life and well-being. And the things we study or we are interested in as researchers and policymakers are often broad. And in order to do that, we need some ordering to this chaos of social realism. If you look at the map on my right hand, I don't know which probably should be on your right hand as well. So this is a study done by the one researchers in the UK about obesity and the factors that are linked to obesity. I'll share the link later on. And you can see that there are multifactorial elements that are associated with obesity, some coming from the individual in terms of either their dietary habits, their lifestyle, exercising, sedentary behavior, and other things. Some also coming from the food environment, some coming from the physical environment itself, and others. And geography, especially in terms of GIS, help give us the tools as researchers and policymakers to order these chaos situations. And the tools in the sense that GIS, if you know GIS very well, it has a database component, it has an analytical tool component, and it's a dynamic system such that you can update the information as and when there are changes to what is of interest to us as researchers. So there are endless possibilities in terms of using geography to understand the relationship between environment and health. In this case, urban environment and health, be it mental health or physical health. This is also another systems map of mental health in cities and factors that contribute to mental health. So you can see, if you look at the legend, you have the individual factors, family-related factors, factory, education, city planning itself, medical history, economic and financial system, social environment, and government structures. So you can see how broad or multidimensional these factors are and how they interact together to influence mental health of urban residents. And to be able to have this comprehensive knowledge of the factors that inform mental health and also develop holistic interventions and strategies and policies to address some of these challenges. As researchers and policymakers, we need these key geographical tools and skills in order to understand or develop a comprehensive solutions to issues of mental health or health in urban areas. Now, one thing is there's always seems to be a gap in when we talk about environment and health or environment and mental health in terms of studies in the academia and other areas of research. And this diagram is a study by, what's the name, Collins et al. In 2020. They reviewed all the studies that has been published, I think, from 2000 to 2019 or 2020, thereabout, to look at the distribution of where these studies were carried out. And if you look at the map, you can see that the studies are basically mostly in the global north or developed countries. Very few in some global south countries like India, China, and some Latin American countries. So on the top, we have observational studies that use observational data. And the middle, we have experimental studies. And the bottom is the total of all studies, so both observational and experimental. And you can see that, especially in Sub-Saharan Africa, there is less or virtually no studies in this regard. So there seems to be a gap in terms of our studies on the relationship between environment and health. And as researchers and as policymakers, we need to think critically about this. Is it that urban or environment or green space is not, and its relationship with mental health is not important in the Sub-Saharan Africa or other global south countries? No, but it's often because of either priorities that we give to certain aspects of health. For example, in Sub-Saharan Africa, we tend to focus more on infectious diseases such as HIV, tuberculosis, and others, rather than mental health issues. But you can see that mental health is a growing health crisis, public health crisis in Sub-Saharan Africa, and so many studies have pointed to the growing burden of mental health among Sub-Saharan African populations. All right. So one of the tools, as I mentioned earlier, mental health is often a moving target in the sense that our state of mind or our well-being, mental well-being changes based on the interaction we have in our everyday life. And most of the methods that we use as researchers and policymakers are often the traditional static method, where you can ask someone, oh, how are you feeling in the past 4 days? How do you feel? We don't capture the momentary effect of urban environment or the environment that people or the interactions that people are having and its impact on their mental health. And geography offers us that opportunity in terms of ecological momentary assessment. So EMA, as it's known, is a methodological tool that helps us capture the experiences and motivations of people as they are immersed in their everyday activities. So, for example, instead of the potential for recall bias, we ask people while they are either at work environment or if they are at the park and enjoying maybe the leisure time with family or they are commuting to work. So it gives us that ability to capture experiences and motivations whilst the activities are taking place. There are three main methods of EMA or methodological approach in EMA. The first is known as the time contingent approach. And this is based on the fact that at certain time, the researchers define time. The app or whatever tool is being used ping the users about certain questions, either their dietary habits, smoking behavior, or sensations to smoke or other things. So depending on your area of interest as a researcher. And it's been used in a lot of studies like urban mind and Martinez. The second one is event contingent approach, where individuals, it's more like an activity diary, report certain interesting events that occur in their daily life, the moment it occurs, based on the research interest or the what is of interest to us as researchers. So it could be triggers of drug use. Maybe someone gets into downtown, sees maybe a sign of cigarettes advertisement or something, and that will trigger the sensation to buy a cigarette to smoke. Then they can report that through the app or the tool that is being used. And the third one is a more geographical approach, in the sense that it's called a signal contingent approach, where basically we send the app triggers response or questionnaires based on certain locations or where the users are located. So the concept of geofencing is the fact that of certain urban interests, you define or create virtual fence around them, so that when users get into such environment, the app can ask them questions about how they are feeling or what is of interest to us as researchers. So in the studies that I'm talking about, I'm going to talk about in a few moments, we use the last approach, which is the geofencing approach. And I'll talk about why this is important, especially in urban health, and the fact that different urban environments contribute to different health outcomes among populations. So the first study that we used the signal contingent approach in terms of EMA is the REGREEN project. So the REGREEN project is a Horizon 2020 funded project by the EU. I think it's about 6 million euros. And the main aim of the project is to look at how, by using nature-based solutions, we can enhance urban well-being among urban populations in 3 European cities and 3 Chinese cities. And it's a consortium made up of different partners, including researchers, urban planners in the 6 major cities, as well as some small and medium scale enterprises or businesses in these cities. So in my task, or in our task, we focus on basically using ecological momentary assessment through a mobile app to capture the restorative benefits of nature-based solution or urban nature on the mental well-being of residents in China and Europe. And the method basically involves creating a virtual fence within these cities among major 6, I think 6 different types of urban green and blue spaces. I'll talk about them briefly. And that collects data on the frequency of or duration of visit, as well as the positive and negative effects associated with being in such environments. And it also provides the opportunity to respond to certain environmental change within the city. So some of the sites that we chose for this project are sites that are being developed as nature-based solutions, and people are using them. So it also helps us solicit feedback from the users on what they think of the project, what are the challenges, what are the opportunities or benefits that they are getting from some of these sites. So we define 6 main types of urban nature, and this is based on the different types of land use of urban nature in the 3 European cities. So the first is urban nature of historical or tourist purpose. So these are either gardens or green parks that have some historical values. So if you go to Paris, I think there is this big garden which is I think it was implemented or developed during the time of Napoleon Bonaparte, and so it's a famous tourist site for most tourists in Paris. So the way people use such environment is different from other types of urban green space. Then the second one was a water-based urban nature, wetlands, marshy areas. Then the third is urban nature or NBS for biodiversity conservation. So where the main purpose is biodiversity. The fourth is urban nature in deprived or suburban areas with vulnerable population. So we know that in urban space, there are often population tend to be segregated based on settlement patterns and others. So we're interested in looking at how this vulnerable population or economically less fortunate population also use the urban environment and its impact on their mental health. The fifth is of mixed purpose. So it could be for leisure, it could be for biodiversity, it could be for tourist purpose and other things. Then the last is urban nature for leisure activities based on parks, sports, and other thoughts. So the map on the right shows basically the locations that we selected in Aarhus, in Denmark, and these are the various parks. And you can see that they are fairly distributed across the city. Then we have that for Paris, the different parks in Paris as well. So what now the app has two main questions. The first is the socio-demographic questions, and the second is the affect or mood. So what the app does, as I said, is that we've created a virtual fence, which is shown by the polygons on the map around these parks. So when a person is about 10 meters from the park, the app triggers a question and asks the person how they feel. So are you happy? Are you sad? Some basic questions, psychological questions. Then after they've crossed the boundary and entered into the spaces, after spending about 10 to 15 minutes there, the app also triggers the next questions, which also asks them basically the same questions as the first one. But the concept here is that we are assessing the effect, right? So we want to know how the person felt before entering into these green spaces and how they feel after being in the green spaces or blue spaces after maybe 10 or 15 minutes. So it's a very short question that basically takes less than a minute to answer. And it's available on the in both Android version and also in iOS version as well. So this is some of the basic interface of the app. You can see the basic introduction background. Then you have the basic social demographic questions. Then these are so it's a 7-point measurement tool, which is known as the ROS scale, restorative health scale. So it asks about happiness, calmness, alertness, energetic, awake, some other methods. And users rank how they feel on either 1 to 7, 1 being either not at all, and 7 being completely happy or completely calm in the locations that they are located. I must emphasize this study is still ongoing, so we have not done with the data collection, hence not been able to present anything on it at this stage. Then the second project is also very similar to the REGREEN project, which is an ICARUS project. It's also EU-funded project under the Horizon 2020 innovation or initiative, sorry. And for this particular studies, we try to look at how people commune in their cities and the kind of places that they love or enjoy in their urban locations, and try to understand the benefits that these locations provide for urban residents. So to do that, we used something which is similar to the ecological momentary assessment approach, but this time we used Maptionnaire. So Maptionnaire is basically a GIS-based questionnaire where people can map their experiences. So they can point to locations, speak about it, share their experiences about that location. And this tool is very important because it can also help in terms of policy engagement or citizenship engagement in terms of urban planning and urban development. So for example, if there is a development going on, let's say create more parks in the city, we can use this tool to find from the citizens where the parks need to be sited, why they think it ought to be sited in these locations, and other questions of interest to us as planners and developers. So basically, we noticed there were 4 major outcomes from the sorry, let me take a step back. So for this study, we did it in 2 Danish municipalities, Copenhagen and Roskilde. So Roskilde is more like a commuter urban area where it's a small city, but because of its proximity to Copenhagen, a lot of people who want cheap real estate stay in Roskilde and commute to Copenhagen for work and other economic related activities. Then Copenhagen being the main town, the economic and political capital of Denmark. So the urban environment in these 2 cities are completely different. There's more green space around Roskilde than in Copenhagen, and also the land use patterns also differs. We wanted to get some insight on how some of these benefits differ in different urban environments. So we were able to recruit about 1,400 respondents, with about 600 being in Roskilde and the rest being in Copenhagen. So We had four main outcomes that people expressed in terms of their favorite locations. One being restorative or the mental health benefits, two being the physical activities. It offers them the opportunity to either exercise or engage in some form of exercise. Then three being socializing, getting to meet friends, talking about social life, engaging, interacting. And the last being cultural benefits. So either places that have cultural or historic values, so they visit such locations, and these locations are their favorite places. Then what we did was, at that time, we had very little, or we didn't have environmental data, and the project was coming to an end. So we decided to go with the basic demographic questions to look at how these household and individual factors affect the distribution of these four different type of benefits in the two major cities. And to do that, we use a Bayesian framework known as the spatial point modeling process, which we implemented via the INLA process using the spade approach. So the whole idea of the spade approach is that the processes that are interest to us as researchers are continuous in space, right? And to be able to capture this continuous spatial process, what we do is to discretize the space into a finite amount of polygons. And based on that, we can measure or capture the intensity or the distribution of these benefits across space in relation to the individual and environmental factors. So basically, the diagram you see on the right shows the discretization process, where we create non-intersecting triangles or mesh to capture the distribution. So where you see smaller triangles are the places that people selected as being their favorite places. So we confine the space. So for example, we can say that, okay, for each point or location that someone selected, we create a triangle boundary, which is about, let's say, 5 meters or 100 meters from around each point, so a buffer. Then based on that, we do the modeling of the intensity of the process based on the response that we have. And it's basic, the basic logic regression model, but with the spatial component in it. And so that's the basic formula. If in simple terms, you have the outcome, then you have the covariate, and the IID is because we have the measures coming from individuals, and one individual can choose multiple places as being their favorite places. Then we have the spatial effect or the random spatial effect component, which helps us understand the intensity or the distribution of the benefits that people derive. So based on the results, we can see the first one is the restorative benefit or mental health benefits, and places that are between yellow to red are places with high likelihood of people having either mental or restorative benefits in Copenhagen, and the blue places are where people are less likely to have restorative benefits. And the B, or the second one, is where people have high physical activity benefits within the city. So you can see the distribution, the same concept as the scale shows. Then we have C being the socializing benefits. So the red areas are where people are more likely to be socializing compared to the blue areas. Then the last one is the cultural benefits. So areas in the cities where people are more likely to enjoy cultural benefits. And blue is where they are less likely. Then what we also did was to look at areas where people were more likely to have all four benefits. So they are more likely to have both mental, social, physical activities, and cultural benefits, and areas where they are less likely to have any of the four benefits. And that is mapped over here by the blue and orange indicators on the map on the right. So the blue is the low areas in Copenhagen where people are less likely to have any of the four benefits, and the orange is areas in Copenhagen where people are more likely to have any of the four benefits. And we created an interactive map to help it with policy making. I will skip and probably open the map, sorry. And this interactive map is important because as a tool, it helps policymakers engage with our researchers as, our result as researchers by either looking at the results, panning into the locations, seeing, okay, which areas provide the more benefit, which areas provide the less benefits, and what are some of the activities, socioeconomic activities or endeavors that are taking place in such areas, and how we can enhance or ensure equitable distribution in terms of some of these benefits. And so you can choose, so that what we are seeing now is the restorative benefits, and we can change to, let's say, the physical activity benefits, and you can zoom in, look at the underlying land use pattern or background characteristics. Then we have the social, cultural, as well as the high and low likelihood patterns as well. And we have the same thing for the Copenhagen. And because these are interactive map or web-based map, citizens can also engage with it. For example, if you want to solicit feedback from residents that this is what we've done, this is the result, what do you think about these maps or these results? They can also provide feedback on you. So for example, if you're having a stakeholder consultation, you can show them the map, they can interact with it and provide you feedback based on the result and the patterns. Okay, so let's return to the slides. Sorry. And the same concept as in Roskilde. So to talk briefly about what these results indicate, basically what we found out was that in publicly accessible areas, green and blue spaces, people are more likely to have any of the four benefits, either be it restorative benefits, physical activities, socializing, or cultural benefits, whilst there were certain green and blue spaces in the two cities which were not accessible to the public, either because of development around or land use patterns around. And in these places, we found out that people are less likely to have any of the four benefits as seen in our research. So what we argue is that it's not just having a green space or blue space or in the urban space, but also making these available to populations. So by creating accessibility to some of these locations, environments, and accessibility in the sense that when we are creating some of these blue infrastructures and green infrastructures, we need to think about the land use patterns around it, whether it's inviting or welcoming to people of different socioeconomic background. Because some of the areas, for example, in Copenhagen, we found that they were surrounded by high income or high affluent neighborhoods. And because of the affluence around, it prevented people from accessing some of these locations because these communities may be exclusive to certain social groups. Hence, even though people can go, but they have to pass through these communities to access some of these green and blue spaces. And sometimes because of the tension between social classes, people may not access it even though it's available for them to use as well. And even the distribution of some of these blue and green spaces also speaks volume in the sense that most of them can be found in affluent areas compared to a high population or immigrant areas in Copenhagen. So if you know Copenhagen very well, you can see that these areas are basically in central Copenhagen, and the outlying areas is where most you have the immigrant population, especially the non-Western population, immigrant population living. And we can see that all the benefits are concentrated in where you have either Western or European, Danish population settlement clustered. Hence, the distribution of these benefits are not equal in the city. And for Roskilde, it's often mixed in terms of the distribution of population, with basically most Danes living in the center and also outside. So you don't see that effect as you do see in Copenhagen. So in conclusion, geography offers a lot of benefits in terms of our study as or our insight or quest into understanding the relationship between urban environment and well-being, in the sense that it offers a holistic view of how urban environments impact our health, both from economic, social, political, infrastructure dimension. And it also offers us the tools to organize some of these factors or dimensions and also visualize or understand how they impact our health. It also offers a real world-term opportunity to look at how people engage with the environment, as well as the impact of such engagement on their health. Then it also offers a tool for citizen empowerment, in the sense that some of the tools available like EMA often help us to engage with citizens, understand their motives, understand their experiences, and in so doing plan, create an equitable planning policy or intervention measures for them. Then the last and not the least is our ability to visualize some of these spatial or factors, environmental factors, and understand the context that influences the result that we are seeing as researchers. And by so doing, it offers pathways to understand urban resilience, especially to environmental insult and other adverse environmental effects on urban residents. Thank you.
This was very interesting presentation. As people are gathering their thoughts and maybe thinking of questions, I do have some questions. Question one. So you mentioned the applications, right? And that people would be prompted when they are near a site to fill in the questionnaire. How do you reach out? Oh, sorry, my computer shut up. How do you reach out to people actually to fill in the questionnaire and have the application to start with on their phone? How do you target them? Also noting that people who have mental issues like anxiety, depression, and so on tend to really spend their time indoors. So how do we reach out also to those people who are affected by those, mental issues?
Yeah, so as I mentioned earlier, this particular project was in relation to the urban or city authorities in the 3 or 6 cities that are of interest, depending on where you are looking at. And because we have these stakeholders on board, they help us in terms of reaching out to the vulnerable populations as well. So some of these cities have programs that are aimed, especially in the Aarhus, they have programs that are aimed at immigrant community, that are aimed at the less fortunate in the urban area. And so we approach them through some of these organizations or networks. And by so doing, we tell them about our study and what we aim to address as researchers or understand as researchers and the values that they can add to our research, right? Because it's not just they giving, but whatever experiences they are sharing, we using that experience to help create equitable environment within their cities. So for this particular project, it was very of key interest to me because we had a multi-blend of actors involved, right? It's not just researchers, but we had city or urban planners or city authorities on board. We even have businesses on board. And by so doing, I feel we create diverse opportunities for even the less vulnerable in the society. For those with mental health issues, that's a very important question. But it depends on how you frame your research. If you want to target such group of population, I think you can also reach out to community organizations that focus on this group of people. And by so doing, you can reach out to them and also understand, for example, what motivates them to go out and what type of environment they utilize when they go out, as to opposed to when they are indoors. Yeah.
Okay, thanks, Prince. I mean, this is again going back to the importance of collaboration and making use of the network, both from the government side, but also institutions that are in place. And I know also the psychological institutions are playing bigger role these days and are collaborating with planners more and more, especially in the US. This has been more on trend now. I can see 4 questions, so maybe we can go by terms of order. Chelsea, Blaze, Weikon, and then Ying. So Chelsea.
Thank you, Prince. Can you hear me now? It's super nice presentation. I'm so glad to see your process after leaving Denmark. And also, I'm so great to see REGREEN already published the app. Because I remember when I was in Denmark, they're still working on that. So
Yeah.
I just have a small question about that, how well the REGREEN control the data collected. Because if we use the application for other studies, well, we have the access to the raw data, or the data is already have been dealt with by the REGREEN, so how they control the data. And also another question, I just keep it short because I saw there are 4 raising hands, so people are really interested in this topic. So another question is I saw you use some indicators, and all these indicators you designed for Denmark, or it's general indicator, and you can also use that for other contexts, like in Africa or in another regions. So how do you think about how we adapt the indicators you already have for another concept?
Yeah. So in terms of the data control, because of EU's GDPR rules, we cannot share the raw data with people outside EU, right? But we can share probably the anonymized data or aggregated data with people who are interested, researchers from outside EU that are interested in it. So I can't remember we even had this discussion because some of our collaborators were from the UK, and UK during the Brexit were moving out of EU. So we had to, during the ethics process, we have to define how we are going to manage the data since we have collaborators in UK and UK is now exiting. So that's basically the main thing around it. But the app itself is an open source app because the whole idea was to help others use the app in terms of engaging with citizens and also for citizenship empowerment. So if anyone is interested in the app, we can share the code with them, or if they want to utilize the app itself and probably change the server where they collect the data, they can also reach out and we can discuss that. Regarding the indicators, so one thing I have to clarify is that basically in terms of the benefits, it was an open-ended question, right? So the people were able to fill what the benefits, write about the benefit they derive from the environment, and based on that, we aggregated answer into these 4 different components. And this may not be ideal for different locations, but I think by using the open-ended approach, if you use it in Kenya or other contexts, I think you also tease out the values that people derive from some of these environments, right? Instead of having a predefined answer for them, because often by doing so, you constrict people's worldview or the options or their responses, or even limit the ability for them to express themselves in terms of some of the benefits or experiences or they derive from some of these locations. I don't know whether that answers the question.
Yes, exactly. Thanks, Brent. Maybe this.
Yeah, thanks a lot, Professor Plens, for this very nice presentation. It was a very nice presentation, of course, highlighting this green space and mental health on the global scale. Actually, when I was looking to the picture of the global scale about this green space research, I was seeing that if you look at the picture, you see that especially cities of the global south, if you look at the research of the work which are being done over there, still almost, I was almost looking at the map of Africa, you see no data available for that. Like, as researchers, what do you think, or what do you plan maybe to advance this kind of research, planning for health in Africa? Because if you see the projected population growth in the coming years, you see that like Africa or the cities of the global south will be having like a half of the population, most of half of their population will be mostly urban, and you still see this challenge of urban green space accessibility, mental health issues. What do you think can be done maybe to address these ongoing challenges?
Yeah, I think
that's cities of the global south.
Yeah, I think it's a good observation, and that's also the main reason why I included the map in the presentation. And that's often because, like I said, most of the international stakeholders in health, especially in sub-Saharan Africa or global south, are often focusing on infectious disease. And the assumption is that our health problem is all infectious diseases, which is often not the case. That is not to say infectious diseases are not important, but we should also dedicate some resources to, non-infectious diseases, non-communicable diseases, and also understanding the environment. Like you said, urbanization is on a rapid scale in Africa and some sub-Saharan African countries, as well as global South countries. But what the main problem is the fact that often it's unplanned. And so by doing so, we destroy the natural environment and we are not able to fully utilize the benefits that these natural environments can provide us. So I'm sure if you come to Kenya as well as when you go to Ghana, where I'm from, you see that most green and blue spaces have been polluted. Either they become dumping site for the growing population, and they're often inhabited by the less fortunate or socioeconomically vulnerable population. And so I think when Zhaoji offered the opportunity to present my research with your team, I was happy in the sense that I hope with your status as a major stakeholder in urban issues and with my status as a researcher, we can forge a collaboration and tell some of these funders that, look, these are very important issues that we need to look at, that we don't have to wait until it gets out of hand before we try to study, what is happening, how can we address this. We need to tackle it whilst it's still young and we can prevent it, right? So most often, when it comes to some of these environmental health issues, often people wait until whatever research or policy has been implemented in the global north is done. Then later on, they think about the global south. But we need to match together, right? Once as we are thinking about air pollution in the global north, we also need to think about air pollution in the global south. What are the measures we can develop to address these environmental challenges in both aspects? And that's what my school at NYU, we focus on global health issues, developing global solutions, and not looking at one side and ignoring the other. So I think that this is one way to forge forward. And when we, as both as stakeholders and researchers, come together and advocate for that agenda, I think then we have the funders listening that, yes, we need to do something. And we also need to empower the local human resource in the global south to deal with some of these rising health issues or environmental crises.
Thanks a lot, Professor Prince.
You're welcome.
Thanks for your question. I see why Kunchi lowered her hand, but maybe you can write it on the chat and then Link, you can go ahead.
Yes, thank you so much for the fantastic presentation, and I'm really impressed with the design of the tour. But I'm wondering because I think sometimes the activities or the feedback will differ from the daytime or the night during the night. So I don't know if the time is a factor. The time a factor in the consideration of the process of the survey or the design of the app. So and also is it able to also map to watch the differences among hours during a day? But I think that generally, I think the tool is very, very useful for us to visualize the activities and feedback from our citizens. Thanks. Over to you, I think.
Yeah, so it's true. The app is developed in such a way that it has a timestamp for the data that you are collecting, right? So even the timestamp, you can get the timestamp for before they entered and after they've entered the locations. So if you want to do a temporal analysis, you can do that. It's also developed in such a way that you can collect data from the same site, from the same person on multiple occasions. And in that way, you can also have the aggregated effects of the space on mental health. For example, let's say today I went to the park closer to my house, but because I had maybe problems at home, so I went there, even though I was there, I was supposed to calm down. I wasn't able to keep calm because of whatever issue was going on in my house. Now, over the next 2 weeks, I keep going to there, and per my responses on the app, you see that it changes. So then we can say that, okay, then the first response might be an outlier, concerning the fact that it could have been something that is happening which has no relation to the context that is of interest, but probably from wherever the respondent was coming from, right? So that's what I'm saying. You can, when you have multiple response from the multiple sides from the same person, then you can know that, okay, this is the actual value or the actual effects coming from the site on the person's mental health. You can also look at the time of the day. I think Xiaoji did something like that for her PhD studies, where she looked at morning, afternoon, and evening, and it effect on people's stress level. And the same thing, you can do the same thing with the app. The stamps are in. So it depends on the only limitation is you as a researcher, what is of interest to you and your research goals. But you can basically do multiple things with it. Yeah.
Thanks a lot, everyone, for your questions. I think we exhausted the 1 hour.
I think there was a question in
Yeah.
the
There are
chat.
some questions in the chat. I mean, you can answer them if you want privately, or you can stay like 5 minutes and you can respond briefly. But I can see them coming even more. So just to be mindful, because other people have other engagement, what we can do is like maybe give you like send them, and you can maybe respond to that in private directly to the team.
Sure.
But yeah, I want to thank you again for making the time for us. We also want to make sure that we will be doing more of these brown bags to gain more knowledge internally between the colleagues. And at some point in October, we want to open it up for more people to be able to join such exchange seminars or platforms. We do have a couple of events happening from now to November, being like the call for paper, where we are launching young researcher challenges on urban health. We have the Health Urban October series of brown bag that I mentioned, the World Mental Health Day campaign, and then the International Conference on Urban Health in Atlanta, where we will be going as Habitat to do some opening and plenary remarks. So if you wish to know more and about some of the things we want to do and be part of other brown bags, please fill in the form that Chelsea will send on the chat. And if you need more information, just contact us at habitat@urbanhealthsearch.org. And with that, I will stop the recording. And I thank everyone again for being part of this first brown bag on openness. And thank you again, Prince.
Yeah, thank you, Christopher.